Okay. So we are going to start with the posterior line. The biggest, most superficial muscle is the trapezius. It looks like a trapezoid or a diamond. Upper trap begins on the nuchal line, or the occipital ridge, attaches onto the lateral third of the clavicles. Middle trap runs across. Lower trap runs up and diagonally, so it goes like that, okay? Upper traps elevate the scapula. They draw the scapula superior-medially, which means, come up into my hand. See the scapula, it rotates as it comes up. So scap doesn't just drive it straight up, it brings it medially and internally or externally rotates it. Middle trap draws the scapulas medially. So if I want to see what that looks like, that's middle trap. There's also a lot of rhomboid involved in that. Lower trap begins on the spinous processes of T2 through T12, all the way down here, inserts on the spine of the scapula, right there, okay? So it runs like that, and its action is upward rotation and external rotation of the scapula. So because it comes on this angle, it will, I actually think it does depression as well. Some textbooks will list it as depression as well. Rhomboids. From the spinous processes of T2 to T5, so right along the spine, here's your scapula. It comes down on an oblique angle like that and attaches along the medial border of the scapula. Its action is to retract the scapula like that, okay? So he's got a lot of upper trap involved in that, but rhomboid is right underneath there. It adducts and draws the scapula medially. So all those terms are interchangeable. Moving towards the midline is adduction, moving away from the midline is abduction, and it also, because of the angle, it's going to medially rotate the scapula. Latissimus dorsi is one of the bigger muscles in the back. It's actually the biggest muscle in the back. And it begins on the spinous processes of T7 to T12. This, if you're looking at an anatomy chart, or either your trail guide or an anatomy app, muscles are red, tendon is white. This is all white. It is called the thoracolumbar aponeurosis. It is a sheath of tendon to which many things, including latissimus dorsi, connect. It provides core stabilization, and it provides an anchor for latissimus to work off of. An aponeurosis is just a connection point. And the skull, there's called the galeal aponeurosis because the entire skull isn't covered in muscle. There's only a couple here and a couple there that move your eyebrows and wiggle your ears and stuff like that. And it also attaches at the iliac crest, okay? Iliac crest, spinous processes, thoracolumbar aponeurosis, and it comes up and around like this and inserts on the front side of the humerus, specifically the intertubular groove of the humerus. It adducts and internally rotates the humerus. One of the best ways to see what lat does, put your elbow on your hip. That's all lat right there. You can see all of that fire. That's latissimus. Serratus posterior begins on the vertebrae from T11 to L3 and inserts on the 9th through the 12th ribs. So it comes up on an angle like this. Its job is to depress the lower ribs, which helps with exhalation. The erectors, when you get into anatomy, you'll have to differentiate between the three heads. I'm going to treat them all the same. So they are going to originate from the spinous process, or the cranial ridge, and onto the acromion process. They attach all the way down here at the iliac crest and the SI joint. They don't specifically latch into the thoracolumbar aponeurosis, but some anatomy apps have it as that. When they fire together, all three heads on one side, when they fire, they're going to do rotation of the spine. When they fire bilaterally, which means both sides fire, they extend the spine. Come up for me. Hold. That's erector right there. Thank you. And then the last one is quadratus lumborum. My favorite muscle in the entire human body is QL. It begins on the iliac crest. It inserts on the spinous, transverse processes of the lumbar vertebrae and the bottom rib. It has several actions. The way I teach anatomy is we want to know what a muscle does. You can track the insertion back to the origin. QL is one of those muscles where both the origin and the insertion can move. Most muscles, the origin is stable, the insertion moves. QL can do several different things. So it's the erectors are superficial, QL is deep to erectors. So if I ask him to bring his hip up towards his shoulder, right there is QL, okay? So QL does hip hike. It also, if he was standing up, would do lateral flexion, which is a side bend. QL is kind of a cool muscle. It can do both. It can do a hip hike and a lateral flex at the same time. Because this angle here is on an oblique angle, the attachment is on an oblique angle. Whenever a muscle is on an oblique angle, it means it's going to do rotation. This one will rotate the spine over the ribs, or the ribs over the spine, okay? However you want to look at it. Deep tissue in all of these muscles. I like to teach deep tissue with movement. So if a person is complaining of just generalized back pain, there's a lot of muscle testing and things that I would do, but what we're going to do if you're just doing deep tissue work is we're going to palpate. We're going to find out where I feel the most tension, and he's going to tell me where he feels the most pain. So that's probably a pretty good spot. Yep. Notice how my hands are stable and supported, okay? I'm not going into a guy this size with my thumbs. That's just not a fair fight, and I'm not going to get into it, okay? I will use my hand, the palm of my hand, side of my hand, fist, forearms, elbows, usually in that progression as I need to get deeper into the muscle. This is stripping, going with the muscle fibers of the erectors, stripping rhomboid, stripping lower trap. I also like to get the shoulder involved. So I will stick my elbow right into the tendinous attachment of latissimus and pull that arm up through some rotation. I can also get him to adduct and internally rotate, all kinds of stuff. I like to get into the upper trap and move the shoulder through a comfortable range of motion. My standard general rule of thumb is I never go above 5 on a scale of 1 to 10. I like to make sure that the client can breathe and work with me. This is where I get my theory of you're going to get a lot more out of this if we dance than if we wrestle. Because if I'm causing my client pain, and that muscle up there, the brain is not going to allow them to relax. Okay? Upper trap, rhomboids, serratus, latissimus, QL, erectors. Remember that deep tissue means moving deeper into the muscle, but it doesn't mean causing pain. You have to hook into the muscle to find out where it's tight. Check in with your client about pain level, and then you can proceed, always using good body mechanics. My weight is right over the top of my hand, slow and under control. Deep tissue should be slow. I also like to separate, so I'll pull the muscle in 2 different directions. And I finish my stroke all the way at the next attachment. Okay? And don't forget, this is called the thoracolumbar aponeurosis.